You can bring the mouse over. Quick once. Quick back. There you go. Okay, good.
Hello, my name is Daniel Yoon, and the title of my presentation is Testing the Effects of Aspirin and Ibuprofen on Gut Bacteria. So to start off, we talk about aspirin and ibuprofen. They're non-inflammatory, non-steroidal, anti-inflammatory drugs, commonly known as Bayer and Advil, and they're commonly used as painkillers, fever relief. They're anti-inflammatory and analgesic effects, and they work by inhibiting the enzyme called cyclooxygenase, which is what causes histamine and the inflammatory functions of your body. And they're notable for their side effects, and this is the focus of my presentation. So these are some of the side effects, more common, some are rare, including drowsiness, nausea, vomiting, chest pain, nausea. And both of these are known for their gastrointestinal issues, including irritation, ruptures, diarrhea, constipation, and just to name a few. And the following bacteria share a similar symptom to the side effects. And these are E. coli and Enterobacter aerogenes. And to start off, E. coli is a gram-negative bacterium that's commonly found in the gut bacteria of humans. And some strains are harmless, but some of these can cause infections. And when they do, the symptoms of these include nausea and diarrhea, similar to those of the aspirin and ibuprofen. And this second bacteria, Enterobacter aerogenes, same as E. coli, it's gram-negative bacterium, and it's found in the human digestive tracts as well. And unlike E. coli, this one's a bit more special for their drug resistance, and they're known for their opportunistic infections. The drug resistance shows that it's able to acquire genetic elements that help with their antibiotic elements. And for their opportunistic infections, they can detect when the immune system of the host is down, and they're likely to attack the elderly or the sick patients. And it usually infects the GI tract and the respiratory system. And common symptoms of these infections are fever and abdominal pain, similar to those of aspirin and ibuprofen again. So in a study called Experimental Impact of Aspirin Exposure on Rat Intestinal Bacteria, Epithelial Cells, and Cell Line, the original aim of the study was to test the availability of these three types of cells on their availability to be tested by chemicals to show the effect of the drugs and such, and be used as a sign that the drugs work, etc. And when they were studied for their effect of aspirin, the cellular functions are studied, and the results show that based on the varying doses of the aspirin, there were significant changes within the drug, within the three types of cells, including the gut bacteria. And the paper concluded that the higher aspirin concentrations may alter cellular functions of the gut bacteria. Knowing this, the question I'm trying to answer in my presentation is, what are the effects of these drugs on gut bacteria? So my hypothesis is, this is the main focus. And my hypothesis is that similar the side effects of the drugs, which include diarrhea and gastrointestinal issues, correlate with those of the bacterial infections. So what it basically comes down to is that I think the drugs have an effect on these two strains of bacteria in our gut, and together they cause the side effects. And based on the Enterobacter aerogenes, antibiotic resistance, and opportunistic infection, because the aspirin and ibuprofen inhibits a part of our immune system, in which, they bring down our inflammatory parts, they inhibit our inflammatory parts. I said the Enterobacter aerogenes, they begin their attack. Yeah. So the methods, I'll be dividing the strains into 4 groups. Each combination being the Enterobacter aerogenes with aspirin and ibuprofen, and E. coli with aspirin and ibuprofen. And these will be ranging in from 0 to 100 micrograms aspirin and ibuprofen respectively, with 0 micrograms of aspirin and ibuprofen being the control of the study. And the reason for the varying concentrations is for easier observation and studying of the changes that follow these concentrations of the aspirin and ibuprofen. And basically what I'm going to be looking for is the growth or lack of it within the bacteria when they're coming into contact with ibuprofen and aspirin. And this is basically known as antibacterial assay, which tests the antibiotic functions of aspirin and ibuprofen. So I thought this is where I could use this method. So based on the preliminary research papers I read, I concluded that in contact with aspirin and ibuprofen, the colony wouldn't die, but they would actually increase in size because they concluded there's an alteration in their cellular functions. And further progress with the research would change based on what kind of observable changes have been made and what I can really do with that. And that's it.
Questions?
You just said that the colony would die, but increase in size?
Oh, I said it wouldn't die.
Oh, okay.
Yeah, because of they're known to be drug resistant, especially Enterobacter aerogenes. So I said, if anything, the colony wouldn't at least decrease in size.
Did you mention E. coli after that beginning slide? Like, what is the correlation for E. coli afterwards?
Oh, okay. So the coli and Enterobacter aerogenes, when they infect the body, the symptoms they show for their infections are very similar to those of the side effects of aspirin and ibuprofen, which include these gastrointestinal issues. And these are very similar to the nausea, diarrhea, severe stomach cramps, and the abdominal pain as with the side effects of these 2 drugs.
Can you just relate those side effects back to how, they're tied to your study?
Okay, so the question, the focus of the study of why I'm doing this is to see if there's any correlation in the side effects of these drugs and the symptoms that you can see when they infect the body. And this is based on the study that was done.
Just be careful with that, because you're in no way are you testing the side effects of those drugs. How are you testing gastrointestinal
No, that's not what I said.
Is that what you were saying?
No, I said, what is it? That these, when they ask, what is it? The effects of these like aspirin side effects
Yeah.
might be occurring in their, what is it, effect on the two bacterial strains.
So those side effects might be caused by the bacterial strain,
Yeah, when
Okay.
they come into contact.
which is your big picture. But what are you testing? Because
So,
you're not testing, like no way you're not testing gastro effects. So that
Yeah,
you can
so-
link that to the big picture. But what are you specifically testing? What are you looking for?
okay, so in the simpler terms of what
Yeah.
I'm studying is an antibacterial assay, which is testing what's it, the effects of these like aspirin and ibuprofen on the growth or decrease of these two strains, which basically what I'm looking for in the antibacterial assay is the sizes of the polyps to see if these would affect their growth.
What do you expect to see? Do you expect to see increased growth or decreased growth?
Uh,
Which one would be a better result for your experiment?
A better result would be an increase in growth because if the aspirin or ibuprofen increases the growth of the bacterial strains, then it would show that it may actually induce infections and growth in the body.
What does gram-negative mean?
Gram-negative, it just means what is it? When you test the bacteria, it's not
Not a big
really,
deal.
it's pretty relevant.
Yeah, it just tests negative for gram stain.
It's just like
That's how they
type of
classify
bacteria.
bacteria. Going forward, you know that, but for that, it's just a small detail.
Can I see your methods again?
Methods?
Yeah. Why'd you pick those concentrations?
They were in the studies I've read that studied E. coli and aspirin. Those were 0 to 50 micrograms of aspirin was what they've used and what showed the most effective result. So this is why we decided to go with it.
So, again, on those concentrations, you're saying from 0 micrograms up to 100 micrograms?
Yeah.
You're saying, you mean ranging?
Yeah.
Do you know what concentrations you settled on?
We're gonna do increments of 20.
Increments 20. Okay.
So 0, 20, 40, 60, 80.
It'll be interesting. Okay. Any more questions? Good job. Yeah. Does anybody else want to go today? Chris, are you ready?